I would like to introduce Dr. Andros of Advanced Urology Associates, located in both Joliet and New Lenox. Dr. Andros is a board-certified urologist with extensive experience treating pelvic floor dysfunctions, including overactive bladder, incontinence, fecal incontinence, and urinary retention. Dr. Andros is a member of a number of honorary medical societies. We are ready to get going. So, Dr. Andros, without further ado, I'm going to hand it off to you.
Thank you, Joe, for the introduction. Good evening, everybody. So today we'll be talking a lot about both bladder control issues and bowel control issues and some of the newer advancements and treatments that we have in treating patients. So more than 50% of the people with incontinence have never discussed this with a doctor. And often this is because, the family doctors are very busy doing the things that they do, managing blood pressure, cholesterol, diabetes, and they don't have the time often to spend to discuss the treatment options. Often they're not familiar with some of the more advanced options that are now available that really can not just treat it, but really resolve the symptoms that patients are suffering with both bladder control and bowel control. So the agenda today is to get a better understanding what bladder and bowel control really are and look at some of the care pathways, which is what's the process that we go through with our patients to help treat this problem. And then really break those treatment options down and go over each of those and really try to customize the treatment to the patient's condition and degree of problem with the bladder and bowel control. And then we'll be focusing on some of the more advanced treatment options with the MEDTRONIC's INTERSTIM system and the MEDTRONIC's NURO system. And then we'll have time at the end to have a little bit of question and answer time. So this is a very common problem. And people often feel alone because often people don't talk about their leakage problems, not just with their doctors, but even with their family members or other people that might be able to give them insight or direction. And when they look at the data, it's 37 million Americans that have overactive bladder, which is a form of incontinence and bladder control problems. And then there is 20 million Americans with fecal incontinence. So to put it in perspective, with vision problems, which you would think is very common, you see all the people with glasses on, there's 12 million US adults. And with asthma, 17 million. So these other conditions pale in numbers compared to what we are dealing with bladder and bowel control. So what is urinary bowel incontinence? And is this normal to have as we get older? And the question to that is, it's not normal to have it when you get older. It is more prevalent with age, but there's reasons why this occurs. And these are treatable reasons that we can affect. And what happens with overactive bladder and incontinence? Well, there's frequent accidents. You're getting the feeling where you have to go now. People plan their activities and their days, even their jobs and vacations around their bladder and bowel control. And often they'll avoid eating and drinking, which we don't want people not to drink fluids. They use the usual. If you go to a drugstore, the corner grocery store, and you try to look in the incontinent area, all you're going to see is a bunch of pads and diapers. And this is not a treatment solution. This is a Band-Aid for the problem. So how does bladder control work? It is a very complex process of what controls the bladder. There's local nerves around the bladder. There's negative and positive feedback loops that go to the brain to the bladder. But essentially, the brain tells the bladder when to go. The problem with incontinence is the bladder decides to go without the brain's permission. So it's important that we focus on that nerve control to the bladder to get those nerves working properly. The kidneys obviously produce the urine that fills the bladder. And the kidneys produce urine constantly. Every minute of every day, the kidneys are producing urine, including all night long. Now, obviously, if you drink more liquids, you're going to produce more urine at that time. But if we drink the that require 32 to 64 ounces of water or fluids a day, you're going to produce about 2 liters of urine a day, which is quite a bit. The digestive system is very much connected to the urinary systems, very similar neural pathways. So again, the bowel is controlled by the brain. You have a bowel movement when you decide to have a bowel movement. But if the nerves in the bowel go awry, you can have bowel movements without the brain's permission. And this leads to the fecal incontinence. So there is a mirror between how the bladder is controlled by the brain and the bowel. So incontinence essentially is affected by daily habits as far as what you eat and drink. If you have excessive caffeine, drinking excessive amounts of fluid, that could definitely exacerbate both bowel and bladder issues. Medications and supplements can have an impact, especially some medicines you need to be on, like diuretics or water pills. There's some supplements that can be constipating or really affect how bowel absorption works. So it's important to look at some of these other medication supplements and see if there's alternatives that we can do. Reduced physical mobility is a big part of both constipation and urinary troubles. Our body needs to be moving for the nerves and the bladder and the bowel to be functioning normal. It's very common to see people when they're in the hospital and ill or after surgery to have significant bowel and bladder problems. So it's important that we keep our bodies moving and we do everything we can to maximize our mobility. Now, there's other things that can cause damage to the nerves in the pelvic area, like pregnancy, childbirth, radiation, pelvic floor injuries, such as through a surgery in that area. And when those cause damage to those nerves, that can lead to both bowel and bladder control problems. So the bladder control could be from various issues. There's really 3 main types of causes with bladder issues. One is a stress urinary incontinence. One is urinary retention. That's when we can't urinate. We retain too much. We're not emptying out properly. And the third is the overactive bladder, which we call OAB. And this is a bladder that just doesn't know how to rest, just goes all the time. So it's important to really identify what is the cause and what type of incontinence does a patient have, because it really changes how we treat them. So when we look at stress urinary incontinence, this is one that happens with stress on the bladder, stress that occurs from increased pressure pushing on the bladder that happens when we sneeze, cough, laugh, jump on a trampoline, exercising, bending to tie your shoes, lifting something heavy. Often this is occurring during activity. So it's more in the day, usually less at night. So people say, yeah, I'm leaking just in the daytime, but at night, no problems at all. We start thinking about this could be stress urinary incontinence. And it could be very debilitating. People stop exercising. They stop going out. They stop dancing. They stop laughing with their friends. So it could be life-altering having this type of incontinence. So what is urinary retention? That's when the bladder is full, but you don't know that. You feel like you're emptying, but you're not emptying your bladder all the way. And the bladder is like a tank, like a gas tank. You can only fill it up so much until it starts leaking over. And then you start getting this weak dribbling leak that happens sort of constantly, both day and night. And often the only treatment is placing a catheter in the bladder, because without that catheter to drain that back up, it can back up to the kidneys and lead to kidney problems, even kidney failure. So it's important that we get that bladder draining. And then we have the overactive bladder. And this is one where we get this urge to go. And often the urge comes on sudden and you cannot get to the bathroom in time. It could happen the moment you wake up in the morning, and before you can get out of bed and get to the bathroom, it is already coming out. And it occurs even with small amounts of urine. So you could have just went to the bathroom and now you're sitting back down. 10 minutes later, it's coming out again. So when there's an overactive bladder, the bladder just doesn't know when to stop. It's just constantly going. The bladder pressure is elevated. And symptoms with this can go along with a lot of frequency, just running to the bathroom all the time. And going more than 8 times a day is sort of our definition for abnormal frequency. And it's hard because patients just feel like their bladder is never empty. They feel like they have to go all the time, even when they are empty. And then fecal incontinence is essentially when you lose control of the bowel without warning. It can happen at any time, sitting, standing, with activity, and it can be explosive urge to go, or it could be very passive and just a little bit of seepage. And again, this is very embarrassing for patients. It can inhibit their social life. It can really have an impact on their mental health as well. So there are treatments, and that's the important thing to know. You know, it's just not pads and diapers and avoiding being social and just staying in your home and near a bathroom your whole life. And it's important to be proactive because these treatments are safe and they're effective, and we have options. So there's many ways to treat overactive bladder and fecal incontinence. So the first step is always diagnosing this. And then we go over what could be adding to this problem. We look at their lifestyle, some dietary changes. You know, what can we do to help with those things to improve the problem? And then we move up to the medications. What can we do to help treat it with medicines? And then we go on to the advanced therapies. So there's a bit of a stepwise process we go through when we treat these problems. So the first step is lifestyle and dietary changes. And sometimes it is pretty obvious and straightforward and simple. If you're leaking a lot at nighttime, you know, you may drink a lot less before you go to bed, maybe after dinner, really cut back. It is true that exercise does help the bladder. So it's very important to be active and keep that muscle tone going. There is a physical therapy for the bladder. So sometimes we'll actually put patients to see a physical therapist that specializes in pelvic floor. So it's a unique type of physical therapy, and usually not every physical therapy facility does this, but it can be very effective. And of course, it's not a pill, it's not a surgery, so it is minimally invasive. Now, if those measures aren't helping, if you're still having a problem, and most patients will do the diet and the behavioral modifications on their own without being instructed by a doctor because it's intuitive. And if that's not working, by the time you see the doctor, we're already looking at maybe starting a medication. Well, the medications for this problem have been around for 50 years. And for the longest time, these medications were the only option we had. The problem with the medicines is one, they don't work as well as we wish they did. Number two, they do have side effects, and they can range from a dry mouth, blurry vision, constipation, hypertension. There are even some newer studies showing some of these medicines can cross the blood-brain barrier and cause more dementia, which is what we don't want that. And then when you really follow these patients after they start these medicines, you know, 72% of them stop taking the medicines within 6 months. When we ask, well, why is that? Well, they're doing it because either the pill isn't working, or the pill's causing side effects, which are worse than their problem, or sometimes these newer bladder pills, it's the cost. It's just too expensive. So there's different reasons why the medicines may not work long-term. But, you know, there is a 25% which it can. So if that's not working, so we go to the next level, and we're looking at the advanced therapies. And advanced therapies, you know, vary. And when we look at bladder control therapies, we look at the MEDTRONIC's INTERSTIM system. We're going to talk about that. The MEDTRONIC NURO system, the injected medications, which is injecting into the bladder. And then for bowel control, not as many options, MEDTRONIC INTERSTIM systems or surgical intervention. So injection therapies, the main one out there is Botox, and it can be very helpful. It's not a long-term fix. The injection is usually done under an anesthetic or some local anesthesia. And after the injection's done, which doesn't take long, maybe 10 minutes, it relaxes the bladder muscle. The one problem with the injection is that we don't know how every patient's going to respond. If it if it works too well, the bladder becomes so relaxed that the patients cannot urinate, and then there's a chance they might need to wear a catheter for 1 to 5 weeks because the bladder is not draining. And if it doesn't work well enough, the leakage continues. But if it does work, it lasts typically around 6 months, and then every 6 months we do it again. This is not for fecal incontinence. And we know that after 2 treatments, so you're talking 1 year, each 6 months, that over half the patients stop the treatment. So when a patient stops something, there's a reason. Either it's not working, or they're not liking the side effects, or the cost. Now, sometimes insurance does cover this, and Medicare may cover it as well. So then we look at the Medtronic NURO system. Okay, this is a minimally invasive, safe treatment that's done in the doctor's office, and it's designed to help reduce the bladder symptoms of that urgency, the frequency, the urinary incontinence. It's not for the fecal incontinence, though. And what we're doing is they're stimulating, it's usually a technician, it could be a nurse practitioner. They're stimulating the tibial nerve, which is on your foot area. And this actually corresponds to the bladder. It's an interesting connection. Actually, a lot of this information came from the acupuncture information from the Chinese. And what they do is they deliver a 30-minute in-office session once a week, for 12 weeks. And that really sort of trains the bladder. It's sort of resetting the nerve function in the bladder to sort of wake that bladder up, wake those nerves up. And after that 12-week sessions, there's a maintenance program where you can continue this monthly just to keep that nerve working. So this can be very effective. And it's done in the office. And again, it's not an invasive procedure. It's not a pill you have to be on every day. It's more or less trying to exercise those nerves in that bladder to get it working again. Now, if that isn't a good fit or not successful, you don't have to go through that treatment or the Botox treatment before you do the next treatment, which is the sacral neuromodulation. This is the INTERSTIM system. So this is actually, I always call it the pacemaker for the bladder, but this is a small implant that is placed in the butt cheek area underneath the skin that stimulates the bladder and stimulates the nerves going to the bladder. And when it does that, it does the same thing as that NURO system. You're waking up those nerves, you're getting that bladder to work. And when this is in, you don't have to control it with a remote to urinate and to stop urinating. It's always working. But there is a remote that you do have that you can control it, and we can change programs and things like that. So this type of system is very effective in many patients. Another nice thing about this treatment option is we get to test it before we actually do the procedure. Although the procedure is done as an outpatient, as a minor procedure, we're able to put a temporary stimulator on in the office and allow that patient to go home with this and do sort of a trial run for 4 to 5 days or so. And the patient will know if it works. We don't have to test you to see if it's working. You'll come back and say, hey, I'm not leaking anymore. Or I was on 10 diapers a day, I'm down to 1. So that's what we're looking for, is to see if this is a effective therapy. And we like it because we get to try it before we commit to it. Unlike some of the treatments like Botox, we don't know if it's going to work until we already do it. And then there's no take backs. We got to wait for it to wear off for 6 months. There are different types of devices. They keep getting, the technology keeps evolving. And this is new as far as the newer technology, but this theory of treating it with this type of device has been around for 30 years. But as all things, they keep evolving and getting better and better. So this is by far not anything experimental at all. And so now they have one that is MRI safe. So, and there's one that's now rechargeable because there is a battery in that. And the newer batteries can last up to 10 years, even longer. But there's a one that's rechargeable that can potentially work indefinitely. So you just sit on this little Mophie device and it charges it, every 2-3 weeks. So some people do like that. idea that it's there forever. Some people like, well, the battery lasts 10 plus years, and I'll go with the battery and I have to worry about charging it. So there's options with that. So the test that I was talking about is the test where you go to the doctor. And again, not every urologist does this procedure. So you do want someone who has experience, and your doctor can direct you that way, especially your urologist will know who does this. But essentially you come in, you can drive yourself to the doctor's office. You don't have to fast or stop any of your medicines. You sort of lay on your stomach. The bladder nerve sits near the tailbone. So we measure where that is, and then we place a small little wire near the nerve. So it's not in your spinal column. It's not even in the nerve. It's near the nerve. And we do this sort of with a needle that's like an acupuncture needle, but it's soft. It's a soft wire. Once we place that in the office, in my case, it's usually within 15 to 20 minutes we do this. We tape this on you. We hook it up to a temporary stimulator, and we let you go. And then we tell you, do your normal activity. Eat your normal foods, do what you normally do, because we really want to know with this test, is it going to make a difference? Is it working? Are you having less leakage, less running to the bathroom, less frequency, less getting up in the middle of the night to go? So these are the things that we're looking for to see if it really worked. And if it does work, you come back to the office, we take these little lead wires out. Again, it's not painful coming out. And then we can get you set up to actually get the internal implant. With the internal one, there's no wires. There's nothing hanging out of you. It's in there, and you go on and live your life. You don't have to avoid swimming. You don't have to avoid airports. They do get picked up with metal detectors, but we give you paperwork to identify what it is. But they're very common, and the security in airports are very familiar with these types of devices. As you may know, Medtronic, who makes this system, also makes a lot of the pacemakers too. So, and also it's MRI safe, and that wasn't the case 5 years ago. So this has been good, because if you ever do need an MRI, it's nice to have that option. So it is effective. So when they look at the studies to see, does this really change patients' life? And 89% of the patients using the Medtronic bowel control therapy experience long-term success. And this could be a game changer for these patients. No longer have to worry about the odor or the unexpected accidents in a social public situation. And then when you look at the bladder control system, 76% achieve success, okay? So it's a definitely more effective therapy than the pills that we have and the other lifestyle changes that we have. So in this technology has been around for decades now. And again, it's evolved, it's better now, but it's not something that is brand new. So how do you know, is this therapy the best therapy for you? And it's a question that you have to ask yourself is, is the problem having a big impact on your quality of life? And if it is, usually if you're seeing a doctor, it is. And you're seeing the doctor to fix this and make it better. So if you have significant symptoms of overactive bladder, non-obstructive urinary retention. So what that means is, again, you can't urinate, but not because of a blockage. Now, for women, they usually don't have this problem because the blockage is usually from a prostate. So men that have this blockage and they can't urinate, it may not be a bladder problem. It could be a prostate problem. So that's what we mean by non-obstructive. We'd have to make sure there's not a blockage there. Or fecal incontinence. And you've tried the lifestyle changes. You try, some of the oral medications, and they're still not effective, or the side effects are not acceptable, or the cost is just prohibitive. And these treatments haven't given you the relief you want. So, it's important to get back to living life. You don't want to be sitting at home and having your health deteriorate because you're afraid to go out and do the things you want to do, especially healthy things like exercising, which we know a lot of people with this issue will not exercise because it exacerbates the problem. So, and then living from bathroom to bathroom. I mean, I have a lot of patients who have a place in Florida. They travel during the winter and they literally have to stop from bathroom to bathroom all the way there. And it becomes an issue to the point where sometimes they decide not to go so far away anymore. So it does have a big impact on their life, not just short term, but long term. So, where do you go from here? Well, you can call this 1815 number and make an appointment with us here at Advanced Urology. Of course, I see patients and do this. My partners, some of them will also do this. So if any of you have seen anyone at Advanced Urology, you can call your urologist there and ask them if they do this procedure. And if not, then they'll direct you in the appropriate way. Of course, you can always call me and we can get things set up for you. And it's a simple office visit. You just come in, we discuss, exactly what we're going to do. We go over your medication list. We go over sort of what your lifestyle is like. How is it impacting you? Ask you more questions about some of your specific symptoms of leakage to identify, is it that stress incontinence? Is it the overactive bladder? Is it that retention? There are some tests that we might do if we can't tell if it is stress or overactive bladder, because the treatments are very different for the two. So we do have to identify that. And also there's a percentage of patients, a large percentage actually, that have a mixture. They have both stress leakage and the overactive leakage. And there's treatments for both of those. So here's some frequently asked questions. So some of you, again, you can ask questions. You can type them in and we'll answer as many as we can today, but this might answer a lot of your questions. So how long does the relief last with the INTERSTIM system? Well, there's data out there and studies that show that it can be effective. And a lot of these studies go about 5 years out. But I've had patients that have gone far beyond that time. And I've had some patients where it didn't work quite as long, because sometimes the causes of incontinence could change, and that can change the effectiveness of the treatment that we initiated. But I've had patients where it's been over 10 years and they're still doing well, and they come back to get their new implant because the battery died off and we just change it over. So will it cure the condition? Well, it doesn't really cure it, even though it may alleviate the leakage and you may get rid of the pads possibly. It doesn't cure it, because if it cured it, if you removed the system, you would be better, but it would just go right back to where it was. So technically it's not a cure, but it's a good, effective long-term treatment. What does the stimulation feel like? Well, most patients describe it as sort of a tingle, fluttering feeling in the bicycle seat area. It's not painful, and most patients, after they've had it in for a while, they don't notice it. You'd have to ask them, did they feel that? There is a remote that we can adjust the settings, and we actually give it to our patients. So you're in control of that. So if you feel like you need a little more stimulation, you can up it, and you might feel it. And if it feels a little too strong, then you can back it down. So you're sort of in charge of the unit, but then we do bring you in periodically. We have staffing that's trained to do a full analysis of it. And sometimes we'll change the programming a little bit in the stimulator to get it working better. If all of a sudden things change with the incontinence, we can adjust with the INTERSTIM system to accommodate for that change and hopefully keep that bladder under control. Common question is, will insurance cover the cost? And Medicare does cover the cost, and most private insurances do as well. Now, they're also very interested in making sure that we are treating you appropriately, to make sure that we're not treating the wrong type of incontinence with the wrong technology. So some of the testing that we do is also to demonstrate that you in fact have the appropriate type of incontinence for this type of technology. And can I have an MRI? Well, more and more patients are getting MRIs because they're a very effective imaging tool without radiation. So Medtronic took the lead on this, and they designed their unit, which was never MRI safe because it's metal, into an MRI safe unit. Now there are some parameters they have to follow when they do the MRI, but now you can get a full body MRI with this. So that we're, as doctors, very happy with that advancement that they made. So in addition to risks related to surgery like infection and bleeding, which are very low, because again, this is a minor type procedure, takes maybe 45 minutes to an hour. There's a small incision about maybe 1.5 to 2 inches with dissolvable stitches under the skin with a waterproof bandage. When you walk out of the surgery center after we put it in, there's not a lot of pain at all. I usually give a pain pill prescription, but most patients don't take it. And you can walk, drive, shower, normal things the next day. But I don't want people working out or heavy lifting for about 2 weeks, just to make sure it's really healed properly. So the recovery is pretty quick. But you can get pain at that area. You can get an infection. You can't have the migration of that little stimulating wire. That's why I don't want you, exerting yourself too heavily in the first 2 weeks so it secures itself there. Device problems can happen. Not common, though. I haven't seen a lot of that. And undesirable changes in urinary and bowel function. A lot of that is programming it right, adjusting the unit so it's stimulating the bladder and the bowel properly. Uncomfortable stimulation if it's too high. Again, that's why we allow patients to have their own remote and control it themselves. So when you come into the office and we do the analysis, we have you bring your remote because that's for your device. You're the only one with that. So some more question and answers about the NURO system. So will it cure the condition? Again, it doesn't cure it, but it does retrain the bladder. And that's the way I like to describe the NURO system. It's almost like your bladder relearning how to work properly, because this NURO system is stimulating that bladder the way it should be to keep the control. So the NURO system's not on all the time. After you're done with your 12-week sessions, you're going a month with nothing, with no stimulation, and the bladder's continuing to work. So it does help the bladder, but it doesn't necessarily cure it. So what does the stimulation feel like? Again, it's not painful. It's more of a feeling of a tingling, a little flutter, in the heel area, sometimes near the bicycle seat area as well. Why does it work? Why doesn't it work right away? Well, it's just because we're sort of retraining the bladder. The bladder is a muscle, and muscle has muscle memory. And when the bladder keeps behaving a certain way, it gets used to that. So when people go to the bathroom every 30 minutes, the bladder's used to going every 30 minutes. And it's hard to change that. So we have to get that muscle used to working a different way. And that's why it takes that 12-week period to do that. And that maintenance option is, again, to remind the bladder and the bladder nerves, this is the normal pattern. So will insurance cover this? As with the INTERSTIM, yes, Medicare and many private insurers will cover this therapy. Most common side effects are temporary, and they usually include mild irritation to the skin, mild discomfort in the heel site and the inner leg area, but usually very, very short lasting. So moving on. So this is going over all the references that we've made during the discussion.
Thank you so much, Dr. Andros. This has been so educational and informative. We really appreciate your time, and I appreciate the time of everybody who attended this seminar, and I hope that you found this as effective as I did.
All right. Well, thank you, Joe. I enjoyed it. Thank you very much.
Thank you. Well, this will conclude our seminar. And as Dr. Andros mentioned, if you or somebody you know can benefit from any of the therapies, feel free to reach out to Advanced Urology Associates at New Lenox or Joliet. Have a great evening.
Thank you. Good night.
Night.